Hello and welcome, everybody. Thank you for joining us today as we celebrate the 60th anniversary of the Older Americans Act, advancing states, Meals on Wheels America, the National Council on Aging, the National Association of Nutrition and Aging Services Programs, and US Aging appreciate the opportunity to ground us all in the beauty, the functionality, and the collaborative nature of the Older Americans Act. The dedicated staff, volunteers, and providers who advance the work of the OAA day in and day out should be celebrated for all that they do. Truly, no one knows their local communities and their needs better than these folks. And we want to not only shine light on the OAA, but also our full aging network. All right, next slide. The guiding mission of the OAA from its inception in 1965 remains true today. And that, as you can see here on the slide, is to develop a comprehensive and coordinated system of home and community-based long-term care services and supports that is responsive to the needs and preferences of older adults and caregivers. It is important to note that the Older Americans Act is not means tested, meaning that it doesn't have specific income criteria for eligibility. We know um, that the statistics are what they are, and the number of older adults who are growing older and wanting to stay in their homes and communities continues to increase. And the Older Americans Act calls on the Aging Network to continue to evolve so that services are delivered in a way in which recipients prefer by delivering the right services to the right individuals at the right time. The OAA continues to demonstrate that it is able to delay and even prevent nursing home placement and allow people the dignity to age in their homes and in their communities. The Older Americans Act serves as the access point for those long-term care services and supports. And let's go to the next slide. Here is a slide that really does depict our aging network. So at the federal level, we have the Administration on Aging, and they partner with 56 state units on aging and 291 tribal organizations. In turn, and those state units on aging and tribal organizations are responsible for administering the Older Americans Act services in their respective states and territories. So they're setting policy, they're monitoring, and then they partner with over 600 area agencies on aging. The area agencies on aging are responsible for planning and service areas, and they work with over 2,100 service providers and 80,000 volunteers to make sure that those services are delivered to individuals at the right place and the right time. One point that we do like to point out for the Older Americans Act is just its value. Their services through the Older Americans Act, they support 1 in 6 older adults. So while older adults might not know that the fund source is the Older Americans Act, certainly the good work from the Older Americans Act is being realized by serving so many individuals. Let's take a closer look at our area agencies on aging. Next slide. So our area agencies on aging are the ones who are either directly or through a provider delivering an array of long-term care services and supports. You can see those depicted in this slide below. So everything from nutrition, from either a home delivered meal or a meal that an individual is receiving in the congregate setting. They're overseeing that. They're overseeing supportive services. So anything from our transportation to senior centers to case management, caregiver supports. We know how incredible and how important the work is to support our caregivers, health and wellness activities, and elder rights activities. The important thing to note here with our area agencies on aging is that nobody knows their local communities better and the needs of that community better. So the area agencies on aging are working to develop programming that best meets not only the needs of their local area, but the individuals who live in their area. And that's not going to look the same from one AAA to the next. So their work is really critical here. Next slide.
I think Abby's going to talk me right out of a job. Thank you, Abby. Diving in. Good afternoon, everyone. I'm Amy Gottwalls with US Aging, and we are the National Advocacy Association or Association of Area Agencies on Aging. So I'm going to pick up here and keep building on the great work for my state counterpart. Area agencies on aging, well, the act started in 1965. They were added in 1973 in one of the reauthorizations with, as Abby's already queued up, this idea that in strengthening the whole aging infrastructure in that reauthorization, they wanted to make sure that while there was continuity and consistency of what type of services that we're going to talk about today were being funded out in every community in the nation, so that's always important, right? We're talking about the same types of things, but that there would be that healthy variation and responsiveness in community, both to those communities' needs, whether you're an urban area, rural, but also, of course, making sure that all of the many aging professionals and volunteers engaged in delivering these services can do so in a person-centered way that reflects the needs of those that they are actually serving or should be serving and need to reach. As Abby said, 613 of these area agencies on aging. I wish we were in every state, but in about 42. So there were some states that chose not to implement this system, but there's consistency year over year in those different aging network systems. Next slide, please. Abby's covered some of this. Just know that, yes, there's that variation, but there's consistency both in the services that Congress charges the aging network at the state, local, and community-based provider level to deliver these services. The thing that sets AAA's a little bit apart from their wonderful community partner providers is that assessment of that local need, the breadth of it across all aging services, and then figuring out an area plan, which is supposed to be responsive to those community needs, to those individual needs, reflect that planning and service area and who's living there, what their needs are, as well as the resources and opportunities and strengths of those communities. That area plans and the multiple ones within a state feed up into that state plan on aging, which Abby's members then take from there and have that state level leadership. So there's a lot of planning and development and leveraging of other dollars. As myself, my own and other colleagues' slides will show today, the foundational funding from the federal government is critical, but it's just the first start of the math equation that is leveraging other state and local and private dollars to ensure we can reach the largest number of older adults and caregivers. Next slide, please. Quick note on variation. If the term area agency on aging is new to you, we sometimes change our names down there at different states. States might want them to be called one thing or another thing, but they all have this federal designation as area agencies on aging. And sometimes the name depends on where they're housed. So you can see in the chart on the left that 42% are standalone nonprofit agencies. Others are based in local government. And building on the numbers that Abby gave you about how many volunteers are really at all levels, not just working directly for the AAAs, but at the service provider level as well. We're really run on a very large volunteer base. And you can see this here in particular to AAAs in that they have more volunteers than they do full-time staff. Next slide, please. But I want to dive into, next slide, what Title 3B of the Act. This is the most flexible pot of money in the Act. It allows both states and AAAs to select up to, there are about 25 different things they can spend this money on. And this is wonderful. This helps reflect the needs of communities, allows these agencies to then be able to, through that area plan process and any guidance they've received from their state, to be able to target what is most needed and have pretty strong control over how this would be distributed. Again, the whole point is to be able to meet that local need. The kinds of things that are most often funded under the Act are, of this section of the Act rather, are in-home help. If you don't know the acronym ADLs, that's activities of daily living. This is helping people with bathing, dressing, grooming, as well as some other chore services. If the entire goal of the Act, with the exception of one program, is to help older adults be able to age well at home and stay where they want to stay and survive, thrive, and age well with health and independence, we need to provide sometimes services in the home to make sure that home remains safe and something they can navigate successfully. So that's where you see a lot of these home modifications, chore services, people coming into the home to assist, as well as senior centers, activities funded at senior centers to help people come out of their homes when they're able, engage in the community. So this whole act is about being at home and in the community and staying engaged. Next slide, please. I wanted to highlight one other key part of the act that maybe isn't as sexy as some of the other programs we're talking about, but is critical to how consumers and your constituents and that you and your member are serving need to know about. There is what we call in the biz information, referral, and assistance. Us as civilians might be like the place you call to ask all of your questions about aging and how you would even begin to access these services, because most folks, unfortunately, don't realize what incredible resource the entire aging network is. So I wanted you to know that part of the 3B dollars are funding the infrastructure, again, at the state and local level, to ensure that there are folks like this lady, the real picture from a AAA, answering the phone, helping consumers, whether those are caregivers or older adults, connect to services, as well as some of the other key roles that our members play in helping get people to the services they need and offering them assistance along the way. So next slide, please. And I think that might have been my last. So I'll turn it over to my colleague.
Yeah. Yes. Hello. Thank you, Amy. I'm Laura. I'm with the National Association of Nutrition and Aging Services Programs, NANAS. And our members provide meals and aging services across the country. And over 20 of our members are celebrating more than 50 years of service. So Title 3C is the Senior Nutrition Program, which started in 1972. Its purpose is to reduce hunger, food insecurity, and malnutrition, enhance socialization, and promote health and well-being. Every day, it serves nearly 1 million meals across the country through a network of around 5,000 local providers. And these providers serve meals in the congregate and the home-delivered settings. Um, So the senior nutrition program provides nutritious meals that adhere to the current dietary guidelines for Americans and dietary reference intakes. They comply with food safety requirements. They also provide nutrition screening, education, and counseling with registered dietitians. And the most recent OAA reauthorization in 2020 expanded the purpose of the program to include screening for and reducing malnutrition. Up to 50% of older adults are at risk for or are malnourished, and it's a big price tag annually to treat the associated costs of malnutrition. Our recent research actually showed that participants who received meals for more than 2 years had a lower risk for malnutrition than those who are new to the program. Something that makes OAA meals unique is this flexibility that Amy spoke to implement what works best for their communities. Programs can also apply for innovation grants that support piloting new programs or replicating successful ones. So what that can look like for a meal program is grab and go, pop-up locations, especially in senior apartments or in rural areas, partnerships with restaurants and trucks, and other spaces. Congregate meals are served in a group setting with an estimated 57 million meals served last year. There is a specific congregate nutrition service in Title VI, which is for tribal elders. And this program provided more than 2.3 million meals to nearly 52,000 Native American elders. Every year, we do a survey of OAA participants. And for congregate meals, the average participant is 77 years old. And a majority believe their health has improved because of the program. They eat healthier. It helps them live independently. Most rate the meal as excellent or good. And half of them say this congregate meal provides at least half of their food for the day. And then one other program in the senior nutrition program is NSIP, or the Nutrition Services Incentives Program. This is a lesser known program that rewards meal providers who efficiently serve meals. So programs that served more meals in the previous year are rewarded with more NSIP funds, and these funds can only be spent on domestically produced foods. In the last 5 years, our nutrition programs have grappled with unprecedented costs, with food and transportation costs increasing 3 to 10% every single year. Yet, the senior nutrition program was cut 8 million in FY24 and held flat in FY25, resulting in an effective cut. And these programs cannot keep pace with the nearly 11,000 Americans turning 65 every day. And with that, I will turn it over to Josh.
Thanks, Laura. We can move to the next slide. Hi, everyone. I'm Josh Protus with Meals on Wheels America. We can go to the next slide. I'm going to be talking about home delivered meals, and want to note between the NANASP network and the Meals on Wheels America network, we're really representing the senior nutrition programs, more than 5,000 that are community-based organizations, independently run, that are serving almost every community across the country. And the majority of these programs are providing both congregate and home delivered meals. They're really working to meet seniors where they are, recognizing the particular needs in their communities. Next slide, please. So just a perspective about the meals that are provided through the Senior Nutrition Program. Annually, more than 2 million older adults are served, and just over 250 million meals served annually. So there's a very broad reach, and we're not reaching all seniors in need. And I'll speak to that a bit more in a minute. Next slide, please. So we like to say that our service begins with the meal. Our solution begins with the meal. And we're providing so much more than the meal. The delivery of a meal enables us to provide additional services. So our local programs provide tailored nutrition that is designed to meet the nutritional needs for older adults, but they're also providing a critical moment of social connection. And whether that's happening at a congregate site where there's socialization that happens, or for a home delivered meal where a volunteer goes into the home and is able to provide that moment of connection that may be the only human contact that that older adult receives that day, or sometimes for multiple days. There are also safety and wellness checks and resource referrals that, along with other OAA programs, are designed to help older adults live independently at home where they want to be, supporting improved health, independence, peace of mind, dignity, and respect. Next slide, please. So just overview of kind of what we're providing. 100% of Meals on Wheels programs report that they're providing socialization opportunities. Drivers are trained to keep an eye out for senior well-being and safety concerns. They're making referrals to services in the community when needs are identified. Sometimes that includes home repair and modification services to enable an older adult to remain safely at home. Many of our programs provide pet assistance, and we know that pets are a critical form of companionship for older adults who are isolated and alone. Meals make a huge difference in improving health, helping older adults to feel more secure and to remain independently at home. And I should say, living independently at home also provides a tremendous cost savings to taxpayers. Next slide, please. So Meals on Wheels has done a number of different studies, and other academic institutions have looked at the impact of these services. So these are evidence-based programs that reduce costly healthcare services, reduce nursing home usage, and facilitate seniors to be able to stay at home independently, age in place. Reduction of healthcare costs, increased food security, decreased malnutrition, reduced social isolation, loneliness, and reduction in falls. So an enormous impact across a number of areas through these services. Next slide, please. So senior nutrition programs save taxpayers a tremendous amount of money. Senior malnutrition itself costs an estimated $75 billion a year in healthcare costs. There are a number of other diet-related chronic conditions associated with food insecurity that have a tremendous cost to our healthcare system, as does social isolation and falls. We like to point out that we can serve a senior for an entire year, providing nutritious meals and those moments of social connection for roughly the same cost as 1 day in a hospital and 10 days in a nursing home. Next slide, please. Federal funding is the critical component. In 9 out of 10 local Meals on Wheels programs receive federal funding, and for more than 60% of them, that's half or more of their total budgets. Next slide. We can actually go 2 slides. I know running short on time. Want to say that the federal funding is a critical piece, but it has not increased to keep pace with growing need and rising costs. And currently, 1 in 3 Meals on Wheels providers has a waiting list, with seniors waiting an average of 4 months for meals and moments of social connection. And for those that we're not able to serve, there are tremendous costs because of preventable conditions. And that is it for me. Thank you so much. Marcy.
Next slide, please. Hi, my name is Marcy Phillips. I am the Director of Public Policy and Advocacy at the National Council on Aging. NCOA is currently celebrating its 75th year, and we're pleased to be able to join in this dialogue to commemorate the 60th anniversary of the Older Americans Act. Very quickly, I'd like to cover some of the healthy aging programs of the Older Americans Act. Now, hopefully, it is very clear to all of you that there are a number of pieces of the Older Americans Act that help to support the health and well-being of older adults. None of them are exclusively focused on health, but there is a carve out to support the evidence-based programs that can be disseminated in communities to support the health promotion, disease prevention for older adults across the country. So Title III-D of the Older Americans Act is known as the Health Promotion and Disease Prevention Program, or also referred to as preventive services in the appropriations legislation. And they provide formula grants to all the states and the territories. Funding is then distributed to the area agencies on aging, where in communities across the country, evidence-based programs that can help older adults with medication management, with fitness, advanced care planning, and also provide support to the caregivers that are so influential in preserving the health and well-being of older adults. There are dozens of currently proven evidence-based programs that are approved for local communities to implement with funding. I should note that the resources don't actually go very far. If we're talking about all states, all communities, and all of those AAAs that Amy and Abby have detailed, it's only a little over 26 million to serve the entire country. One of the other programs that actually is a competitive grant are the falls prevention grants that are authorized by both Title II and IV of the Older Americans Act. And these go to support evidence-based programs to help older adults prevent falls and to recover from falls. Currently, 1 in 4 older adults fall every year, and that's actually an underreported number. The cost of falls has escalated to $80 billion a year, 75% of which are borne by Medicare and Medicaid. And we think that that number will grow to 101 billion by 2030. But we know that the evidence-based programs have a strong return on investment by helping older adults recover from the fear of falling, become stronger, improve their balance, improve their homes and their home safety. These innovations can change the cost curve and actually provide savings both to the older adults as well as to the public programs that help them afford their health care. The current funding is $5 million from the Prevention of Public Health Fund and another $2.5 million in appropriation. But it is important to note that of those competitive grants, they're still being weighted, they're still pending being competed and awarded. $6.5 million are still pending that process. So we are hopeful that HHS will be able to get those dollars out the door quickly this year. There's also the Chronic Disease Self-Management Program. Again, another competitive grant program authorized by Titles 2 and 3, I'm sorry, 2 and 4, to expand and to sustain evidence-based chronic disease self-management education programs to help older adults and individuals with disabilities manage their chronic conditions. A significant number of older adults are dealing with chronic conditions. The majority of older adults have actual multiple chronic conditions, and the cost for chronic conditions accounts for 93% of Medicare spending. But chronic disease self-management education is a low-cost, evidence-based interventions which show that they can help older adults manage chronic conditions, diabetes, heart disease, and other conditions that can escalate their use of hospital stays and emergency room visits. The program currently is funded at $8 million with a Prevention and Public Health Fund allocation, but similar to the Falls funding, grants are still pending for this year. They have not been announced or awarded to the tune of over $6 million. So again, we call on HHS to get those dollars out the door to help communities help their older adults strengthen their health and prevent disease. I'll turn it over to my colleague for the next title.
Great, thanks, Marcy. Next slide, please. This is the last subtitle within Title III. It's the National Family Caregiver Support Program. For years, U.S. Aging's members and others in the Aging Network supported family caregivers, and they would draw upon Title IIIB funding, which I neglected to mention that the last official appropriations before we're under constant CRs was about $410 million for the whole country for all of those 3B services. But Congress wisely in the year 2000 created an additional subtitle to Title III in order to provide a dedicated pot of funding as well as federal instruction to the Aging Network to say, we would like you to take what you're already doing that's good, but ramp it up to a larger level to ensure that the caregivers of older adults, as well as older adults who are themselves serving as caregivers for friends or family, are getting the supports they need. If you're up on this topic, there's at least 53 million family caregivers around this country, caring of all ages, caring for people of all ages. It's a huge economic contribution, one in which the federal government and probably all the governments together could not make up for. Billions of dollars, far more than we spend in government dollars to support long-term care. So we need these people to stay in their jobs, but they need help. There's a credible burden, even when people don't want to say that they're caring for someone they love and want to support. It is still a very tough job. And so added to the Older Americans Act, again, 25 years ago, was a title that said, we want you to make sure you all have programs that address these 5 key areas, helping caregivers learn about what's available, both for themselves, but also for their care recipients. There are Older Americans Act programs that have already been described and still are yet to be described to you today, that if a caregiver doesn't know about it, the older adult doesn't know about it, they can get access to those services for the older adult. That may significantly relieve the burden of the caregiver. Caregiver may not need anything else, but sometimes that's not the case, or the care recipient's already receiving services. And so you want to make sure you're exploring all of the options. And to the second bullet, helping those caregivers get access to those services. These are people with very little time. They are likely working in the paid workforce as well as juggling their caregiving responsibilities. And so part of the aim of these programs is to support them, kind of do a navigation of what is available, what is out there, and find, again, in that person-centered way that this entire network operates, what exactly they need, and give them just that. Other options under this program are individual counseling, support groups, training. We're giving an innovation award to one of our members just in a couple days around the fact that they created a program that it's a caregiver support group, but there is a parallel fun activity for the people that they're caring for. So bring everyone together, then go to some community site, and then separate so that the caregivers are knowing their loved ones are cared for while they're seeking support from their peers doing this work. The most popular service under Title III-E is respite care. That's a true break so that that family caregiver can go off and do what they need to get done. It could be go to church. It could be getting their hair done. It could be running errands, their own medical appointments. We know family caregivers often put off the needs of for their own health because they're so busy juggling the health appointments and other needs of their care recipient. And then there is wonderful continued OAA flexibility in this title as well. I've also listed here who exactly is eligible for support through this program under the Older Americans Act. It's not all caregivers, but here are the key categories. And then on the next slide, this is a little bit out of order because we're going to zigzag back to Title V of the Act in just a moment. But I wanted to flag that Title VI of the Act, added in the 1980s to the Act, to ensure that there were funds specifically going to Native American, Native Alaska, and Hawaiian Native organizations to supplement all the great programs you've heard about as well. All of the types of population groups I mentioned can, of course, access services through the Older Americans Act, but to put additional resources in the hands of the tribal nations as well as other groups as mentioned. So Title VI has really three parts, but the first two go together, just broken out by Part A, American Indian, Part B is Alaska and Hawaiian Natives, but together the program is administered in one. As Laura already said, this includes both home delivered and congregate meals. There's a big nutrition component to Title VI, Parts A and B, but it's also supportive services. So it looks like Title III-B. I will note that the funding for these programs is so low in this part, just in the $30 million for the whole nation, that they often can't fund quite as many of those supportive services as their AAA counterparts. The nutrition funding gets used up pretty quickly, and that is often the first and most common service they offer. But many of the tribal organizations who receive this federal funding directly from the feds, of course, too, this does not work through states and AAAs, I should have mentioned that, do offer a panoply of other services such as transportation, senior centers in community and tribal centers, et cetera. And then Part C was added when Title III-E, the National Family Caregiver Support Program, was added in the year 2000. So it's a counterpart program to give tribal organizations the opportunity to provide those direct caregiver supports. And I've given you an example that comes from our funded by the Administration for Community Living Title VI national survey that we do every few years. And you can see the type of services they are currently offering caregivers under that extremely small funding stream of, like, this is terrible, I can't remember. I think it's about $12 million goes out for the Part C. Yes, I'm correct. So more information, I put some links in my slides. So with this, we're going to go back to Title V, and I believe I'm turning this over to my colleague, Marcy Phillips.
Thanks, Amy. Next slide, please. So I apologize for the text-heavy slide here, but I have a lot to say and a little time to get the message out. So Title V of the Older Americans Act authorizes, I'm sorry, could you go back one slide, please? Thank you. Authorizes the Senior Community Service Employment Program, or CSEP. This program has existed as long as the Older Americans Act, and it is the only federal job training program focused on older adults in seek of employment. It's available to unemployed adults age 55 and older who have significant barriers to employment with incomes at or below 125% of the federal poverty line, which is currently over $19,000 a year. Most participants are women with incomes below the poverty line, which is $15,650 a year. Workers in rural areas and veterans are among those who are actually targeted for services. So one thing I should note is, we've all been talking about how the Older Americans Act is not means tested. This is the only program within the statute that actually is contingent upon income and age. And it is a younger age than a lot of Older Americans Act programs, starting at age 55 as opposed to age 60. We know that older adults, even as young as 45, begin to experience discrimination in employment based on their age. So we know that we have to intervene as soon as possible. The participants in the program are placed in subsidized on-the-job training. They upskill and they gain the confidence and soft skills needed to compete in today's workforce. The awards are made to state and national grantees, and I provided hyperlinks with more information about who those grantees are. But the majority of funding is actually for the wages and training of the participants. They earn a minimum wage, whether it is the federal minimum wage or the local minimum wage, whichever is higher. And benefits also extend to the host agencies that provide them the training. For example, the individual that Amy had a picture of could very easily have been somebody who was training for a new job in CSEP or was a new hire based on the fact that they've been serving the community and upskilling and being able to handle the information referral demands at an area agency on aging. 7 in 10 CSEP job seekers who exit the program after a year earn more than their training, and they stay on the job for that year. Funding for the program should have been available as of July 1st, but it has not been made available, meaning that the program has been shut down essentially across the country, furloughing older adults, as many as 30,000 nationwide. We are seeking assistance from the Department of Labor and from the administration to release these resources to help these older adults get back to training, getting back to upskilling, and getting the wages that they need to help make ends meet. We are grateful for members of Congress on both sides of the aisle who have weighed in, who have mobilized their colleagues, who have reached out to the department. We are hoping that those resources will be available to older adults in the short term. Next slide is contact information on the National Council on Aging should you wish to follow up with any of us. Thank you.
And I'll take it next for Title VII. As we've seen, Title III is really the heart of so many of the programs and services that we all know so well in the Older Americans Act. But Title VII, all the other titles that we've mentioned, 5 and 6, are also so important. So it is important that we cover those and make sure that you're aware of those as well. So Title VII focuses on vulnerable elder rights and protection activities. It was enacted in 1972. So just for context, in FY24, these programs were funded at a total of $26.7 million, and the majority of that funding was directed to the long-term care ombudsman program. And if you don't know about the ombudsman program, they investigate and resolve complaints of residents in nursing facilities and other care facilities and care homes. In 2022, the ombudsman representatives worked on almost 183,000 resident complaints, and they were able to partially or fully resolve about 3/4 of those complaints. So their work is very important. Title VII also supports other programs that are aimed at preventing and responding to elder abuse, neglect, and exploitation. Title VII emphasizes coordination between these programs to create a comprehensive elder justice system. And it also includes funding for legal assistance and elder rights development. I did want to note that there is some new language in Title VII that expands the options for states and tribal organizations to use a portion of their Title VII allotments for detection, assessment, intervention in investigation of and response to elder abuse, neglect, and exploitation. We know it is not only such a large problem currently, but it continues to grow as the older adult population continues to grow. The expansion allows for a more comprehensive approach to elder justice and enables states and tribes to develop and improve more coordination and multidisciplinary approaches. So, specifically, the language aims to support multidisciplinary and collaborative approaches to address elder maltreatment, enhance coordination between elder rights and aging and disability resource centers, or ADRCs, to promote the development and implementation of long-term strategic plans for elder justice initiatives. So in essence, these changes really are seeking to provide greater flexibility and encourage a more proactive approach to protecting our older adults. And we do know we need to get more upstream so that we're being more proactive versus reactive. Next slide.
Well, I guess it's me. Hi, I'm Bob Blancato, Executive Director of NANASP that you've heard about before. Let me thank my colleagues first for their thorough, while succinct presentations of on the 7 titles of the Older Americans Act. Let me reiterate a few points. The Older Americans Act did more than observe an anniversary this year. It has stood the test of time as a valuable, cost-effective, locally driven program for these entire 60 years. Most of you attending this briefing could go home to your state or district and find an Older Americans Act program at work. And we encourage you to do this, especially in the August recess. But despite its obvious successes, the Older Americans Act is at a crossroads as we approach fiscal year 26. It is badly underfunded, whether because of demographic growth or more difficult economic times. The demand for its programs and services continues to grow. Yet its funding remains flat for its major programs, including what has been proposed in the president's FY26 budget. 2 years of flat funding for some of the programs, like nutrition, with food increases and transportation costs increasing, is equal to a double-digit cut. While we very much appreciate your participation today, don't just take our word for it. Reach out to your state unit on aging director, your area agencies on aging in your state, your service providers, and most importantly, your older adults themselves. They are our best advocates as they know how the Older Americans Act enhances their lives. And to make this point clearer, let me give you a quote from an Older Americans Act participant. Quote, "How can you measure the value of living in your own home for as long as possible, being happier, healthier with food security and with loving connections? The value is beyond words," unquote. So now let me turn to questions that we have. Let me go to the Q&A. And from Felicia, it says, how do we find out about the programs available in our state or in our district? I'll offer to whoever wishes to respond.
Yeah, hi, it's Amy. I'd be happy to. Of course, now I'm not going to memorize the phone number, but one of the things to ensure that, since there are those different numbers from state to state and slightly different names of all these agencies, the Older Americans Act also funds a national call center. And so that is called the Elder Care Locator. It's eldercare.acl for Administration for Community Living.gov. And you can go there and you can do it online. You can chat with someone online. And of course, we offer full service, real people answering the phones. They're actually in the U.S. Aging office as we're a partner with ACL on this. But those are information and referral specialists who can help you talk about something in another state. You can be a caregiver in Maryland calling about a loved one you're concerned about in Montana. And this call center can respond to concerns and connect you, help you, give you the language. A lot of people don't. They say, I need a ride tomorrow. Can you help? That's the kind of calls we get into the locator, and we help route them to the local organizations or state or occasionally other federal agencies who are best equipped to answer the questions. So that is what I would recommend, Elder Care .acl.gov. For as a great starting point. And then the phone number that I have failed to memorize is right there, but I'll look it up and put it in the chat, but you can also see it at that website address. That helps if you don't know where in your state to go. But as I said, both the states and AAAs all have their own databases full of where these resources are, and they have people answering these calls in one form or fashion as well.
And thank you, Chloe, for putting that in the chat. Anybody else? Any other colleagues want to answer that question? And there is the phone number. Okay. I'll just keep that up for a bit. And any other comments? Okay, from colleagues on this one? I don't see any other questions. Wait a minute, I see one now. Hold on. From an anonymous attendee, with con artists increasingly turning to cryptocurrency and scams to target older people, do you believe Title VII of the Older Americans Act is funded enough to protect or have the technical expertise to protect seniors? I'll let Abby start, and I may have a comment on that one myself, actually. Abby? Okay, well, we'll look for Abby. The answer is no. Title VII needs more resources to deal with that very growing problem. Financial abuse of all kinds, scams of all kinds, need to be more vigorously addressed through the Older Americans Act, through law enforcement initiatives. One thing we would point out, and we hope that it will continue in the months ahead, there is an Elder Justice Coordinating Council that was created through the Elder Justice Act, which has 14 or more different federal agencies working to coordinate their response to things like scams and elder abuse. And it's vital now, as we start to see this growth in crypto scams, that they come up with a plan that can allow older adults to feel safer if they're going to be involved in doing crypto work and cryptocurrency. But I think it's getting more attention, and I think Congress is looking at this as well. And we are all, as advocates, seeking to have older adults protected as much as possible. Okay, let's see. Laura, did you want to make a comment?
Nope, I think you had it covered.
Okay, good. Any other questions? If anybody want to go live with a question, feel free. If not, we will put it into the chat. All right, then I will ask if anyone has a closing comment, even though it wasn't in the script, but we could do that. If anybody has one last thing they have to say, feel free.
I just want to stress something I believe Josh brought up, and it's certainly woven throughout Marcy's and others' remarks, is that, and especially when you've now heard the very small pots of money that the Older Americans Act actually receives, and we're obviously all united in our advocacy, as Bob said, to increase that funding, just not only for the valid economic reasons he mentioned, but also the fact that we have an incredible, historic, never before seen growth in the number of older adults. So this is something that needs to be invested on. But I took myself off mute to reinforce what Josh said, is that investing in these programs, in helping people be healthy in the community, they might not need the service in the home if they've been able to manage their aging process through the community supports and staying engaged and being able to get to their doctor with a ride and all the other things mentioned on this call. We all sincerely believe, and the evidence suggests that when you put this panoply of programs together, you have them provided by trusted local resources, people who trust to go to you if you end up a victim of a scam. They know they can trust these organizations because they're receiving these services from them. But if you can do that and keep people healthier and allow them to stay in their homes, you avoid a whole host of other costs on the Medicare and Medicaid side. So I just want to reinforce that we're a lot for the little amount that is put into these programs, and we could have an even greater impact on those cost curves if this act was invested in to the degree that our united organizations feel it should be.
Thank you, Amy. Josh, anything else?
I'll just add to that. OAA programs really, truly are force multipliers. I know for nutrition programs, in the recent HHS budget, it was cited that for every $1 in federal investment, there are $4 in state and local contributions. So the federal piece is critical. When that doesn't keep pace with growing needs, the state and local and charitable contributions just can't fill in those gaps. So it's critically important to be able to respond to the rising costs and the growing needs across our communities. We know that this is a very challenging fiscal environment and that tough decisions will be made, but it shouldn't be tough to make sure that older adults get the nutrition support, the care, the supportive services that they need and deserve. And the OAA programs have worked so effectively for 60 years. We want to make sure that they're able to serve people going forward.
And if you want to go beyond our own words, let me suggest there's Secretary Kennedy visited a Meals on Wheels America program in Maryland not that long ago and made wonderful comments about the importance of the program. I encourage you to look for that video. If we can get it into the chat, we will. But he talks a lot about the same things that we're talking about, the value of this program and what it does, particularly on the socialization side and the health side. So we encourage folks to track that down, or we'll try to get it into the chat before we wrap up. Marcy, anything you want to say?
Yeah, I just would be remiss if I just didn't emphasize the tipping point that the Senior Community Service Employment Program is at right now. I mean, we do have tens of thousands of older adults who are out of work that were looking to be trained so they could upskill and secure work because they have to work. Either they have very little Social Security benefits because they don't have a very strong work history. Social Security is not enough in many communities to keep people out of poverty. Don't make the assumption that an older adult, by having Medicare and Social Security, have the resources they need to be able to age with financial security. We are at a point now that it's been more than 2 weeks. We have no reassurances from DOL other than it's being processed. Rents are going to come due. Utility bills are going to come due. Healthcare costs and prescription costs are still there. Utility costs are still there. We really need these resources so that these older adults can get back to work. They want to contribute. They want to work. They don't want a handout. And we need all the support that we can get. And again, I do express a lot of appreciation to members on both sides of the aisle who have stepped up, tried to help the seniors in their districts, tried to reach out to the Department of Labor to advance these resources. But it's really getting to be a dire situation. So I just feel a need to emphasize that before we close.
Thank you, Morris. Laura, anything from you?
Just a reminder that if you have any questions after this webinar, please don't hesitate to contact us. We can connect you with programs in your area. And as you can already tell, we are a wealth of information.
Thank you. So again, with other questions, thanks to Abby, Amy, Laura, Josh, and Marcy. And we are proud and happy to give you back 7 minutes of your day. And we thank you for joining us today. And please stay active and involved.